You don't have any other life insurance. You just have Lincoln Heritage. Okay? You right now want to do a memorial service with cremation. Today, that can be anywhere around $4,000. 20 years ago, it was half of that. All right? You're young. Now, if this keeps up the pattern of doubling every 20 years, you may find yourself in a position where Bruce doesn't have enough to take care of everything. Now, Bruce is 30 years old. I'm sure he has a family. Or does he have a family? Does Bruce have a family?
Yes.
All right. So he has a family. He has a life of his own. For him to have to come up with a couple $1,000 last minute, unexpectedly, is that something that would be easy for him?
I guess when it happens.
Really?
I don't know.
Yeah. Most of
He
the time.
does pretty well, but
That's good.
I don't know if he's going to have an extra. How much did you say it is?
I mean, if you live another 20 years, it's going to be double what it is today. So at this point, it could be anywhere around 8,000 or 9,000. You only have 7 with you. You only have $7,000. Not to mention sometimes unexpected health bills, credit card bills, different things that may get, if he has to move everything out of your house into a storage unit, this money can be used for anything. All right. So I'm just trying to give you a little bit of forethought and to try to cover as much as possible while you're young. Because again, there's 2 ways to look at this, a proactive way and a reactive way. Today, you're young, you're healthy. 10, 15 years ago, from now, who's to say? Your health could change, and I know for a fact the cost of insurance is a lot more later on. So, does it make more sense to you to try to take care of this now while you're young, or would you rather wait to pay more later? It literally is one of those pay me now, pay me later. It's gonna happen. If you live longer, it's gonna cost more. Now, if Lord forbid something happens to you and you die sooner, any extra money, of course, is going back to who? It's going back to Bruce.
Right.
All right? So it's a win-win no matter which way you go. I'm just trying to show you a way to prevent him from having to spend extra money out of his pocket. Is that something that makes sense to you?
I guess so.
Okay. So you fortunately are eligible to increase your amount of coverage, and I can show you some options. All right. So what I'm going to do is just simply this. I'm going to go through some of the health questions again to see if anything has changed since the first time. All right, because you look like you were extremely healthy back then. So number 1, you had put that you were a non-smoker. Has that changed? Are you still a non-smoker, or did you pick up smoking?
No smoking.
Awesome. Have you tested positive for HIV or diagnosed with AIDS?
Goodness, no.
Or given a life expectancy of 12 months or less?
No.
All right. Now you're sitting in front of me, so you're not hospitalized in a care facility receiving hospice care, or in a, I forgot the one, hospitalized or in a hospice care, hospital. Bedridden, hospitalized in a care facility or receiving hospice care. There you go. I don't have it in front of me, Bruce, so I'm just going off of memory.
Okay.
All right. The next questions just have to do with the past 2 years. So if it's been longer than 2 years, I don't need to know. So in the past 2 years, have you been diagnosed with, treated by a physician, or taking medication for any of these following conditions? Disease of the heart, including heart attack, heart surgery, or congestive heart failure. Past 2 years.
2 years?
Past 2 years.
No.
Okay. Now, you paused for a second, so did something happen a few years back?
I had some heart issues.
Okay. Are you taking any heart medicine still for that?
Yeah, I take some blood pressure, and they put me on a cholesterol pill.
Okay. Any blood thinners?
What do you mean?
Warfarin, Coumadin, anything like that?
No.
Okay. All right. How about disease of the circulatory system, such as a stroke or an aneurysm, or been advised to have surgery to improve your circulation? Okay. How about cancer, other than basal cell skin cancer?
No.
All right. How about disease? Whoops, you dropped something there. Dropped your membership card. How about disease of the liver or of the kidney, or had an organ transplant?
No, sir.
How about Alzheimer's disease, organic brain syndrome, or ALS?
Who are you again?
You're funny, man. Alcohol or drug abuse?
No.
Complications of diabetes, such as an amputation, diabetic coma, blindness, or kidney disorder?
No diabetes.
Okay. And have you had or been advised to have a diagnostic test related to any of those health conditions, with exception of HIV or AIDS, where you're waiting for the test results to come back?
Well, my doctor did my blood work.
How long ago was that?
They do it once a year now.
Once a year? Okay, so that's pretty much routine.
Yeah.
When did you have that done?
Probably about 6 months ago.
Okay, everything come back okay?
As far as I know.
Okay, all right, so this is good. And again, back to the heart question, the heart problems that you had was more than 2 years for sure, correct?
Yeah, I'm pretty sure it was 2014. I think.
2014.
Yeah.
And as far as the medication, again, just blood pressure
And the cholesterol.
and the cholesterol. Okay. What we're going to do is we're also going to do a prescription check again, just to make sure nothing else triggers. But based on what you're telling me so far, we should be okay. All right.
Okay.
So let me just show you some options here real quick. Like I said, you're a little bit older than what you were, almost 7 years ago. So